Welcome to the Introduction to Innovative Disease Surveillance. This course has been developed in partnership between the Skoll Global Threats Fund, HealthMap, ProMedMail, TefiNet, and NextGenU, and is designed to provide a refresher of the basic disease surveillance skills and information you need as a field epidemiologist or health professional, and to introduce you to newer approaches that can help you improve disease surveillance in your community, country, and globally. In particular, you'll learn about innovative disease surveillance methods and tools like EpiCore. You can choose to take this course on its own or as a prequel to the EpiCore training course. Learning objectives for this course include recognizing the advantages and challenges of traditional disease surveillance, learning the definition of innovative disease surveillance, recognizing informal sources of information, and understanding the benefits of using innovative disease surveillance that is complementary to traditional disease surveillance. Disease surveillance exists because the earlier disease outbreaks are detected, the more lives can be saved. As you can see from this map, outbreaks can happen all over the world, and in a world where disease can travel as fast and as far as people can, improving disease surveillance is critical. Conventionally, health professionals have used what is referred to as traditional disease surveillance techniques. Traditional disease surveillance is the systematic collection, evaluation, and analysis of health information. Traditional healthcare-based surveillance systems rely on healthcare professionals to report information on the illnesses they see in their clinical practice. This information is often collected, analyzed, and disseminated by local health authorities who report to centralized ministries of health. There are many advantages to using traditional disease surveillance techniques. Two of those advantages are that the information received is often highly reliably and easily verified, and that there are standards in place that provide incentives and a uniform structure for reporting. However, there are also some challenges with using traditional disease surveillance techniques, and these include people may not choose to see a doctor when they're sick, or they may see a doctor who works at a facility that's not part of the official reporting system. Not all diseases require reporting by the government or the World Health Organization, which means that novel diseases can go unreported, or there are often delays in reporting due to laboratory confirmation waiting periods. So pause here to consider the following questions regarding the challenges of traditional disease surveillance. What's being missed by the official reporting system? And how could traditional surveillance systems capture information earlier? To help fill in some of these gaps, health professionals have started using what are referred to as innovative disease surveillance methods as complementary additions to traditional disease surveillance. Innovative disease surveillance is defined as gathering health information from informal information sources such as social media, word of mouth, local press, and the like to share that information publicly, transparently, and at no cost. Across the world, different terminologies are used when talking about innovative disease surveillance, but they're all synonymous. For example, as we just mentioned, innovative disease surveillance includes using informal information sources, a term that may also be referred to as non-traditional, non-governmental, unofficial, off-the-record, unconfirmed, unstructured, rumored, and event-based surveillance. Informal information sources can come from articles in the local press or media, reports from individual clinicians or field-based NGO staff, as well as internet-based media such as discussion forums, blogs, and social networking sites. Let's take a look at this graphic that illustrates how connected the world has become. Innovative disease surveillance methods seek to utilize this connectivity to increase the flow of information between health professionals as well as communities, thereby increasing the speed at which an outbreak may be detected. The World Health Organization's International Health Regulation supports the use of innovative disease surveillance, referred to as event-based surveillance, and informal information sources to rapidly detect outbreaks. Indeed, more than 60% of the initial outbreak reports of the WHO Epidemic and Pandemic Alert and Response come from these unofficial informal sources. Pause the presentation here to answer the following questions, then continue when you're ready. Now that we've introduced innovative disease surveillance, let's talk about which diseases are covered under this umbrella. The diseases included in innovative disease surveillance not only cover human infectious diseases, but it also embraces the One Health concept, which recognizes the important links between human, animal, and environmental health. To understand the links between human, animal, and environmental health, it's important to know that about 75% of emerging infectious diseases in humans are zoonoses, and that more than 70% of those zoonoses come from wildlife as opposed to domesticated animals. Therefore, continued surveillance of both domesticated animal and wildlife health is critical for early detection of new diseases that will jump species, and it's very important that excellent communication is maintained between professionals working in human, animal, and environmental health. Pause the presentation here to answer the following questions, then continue when you're ready. As we discussed earlier, innovative disease surveillance, when used together with traditional disease surveillance, can increase the speed of outbreak detection and reporting. Next, we'd like to introduce several available online tools and information sources for rapid disease detection and reporting, starting with the industry pioneers. Early innovative global disease surveillance initiatives included, starting in 1994, ProMedMail or ProMed, which is a moderated electronic event reporting system that monitors emerging and re-emerging infectious diseases and toxic events globally. It emphasizes the One Health approach as it reports on plant, animal, and human diseases. In 1997, GPIN, or the Global Public Health Intelligence Network, which is a secure, internet-based, multilingual early warning tool, monitoring disease outbreaks and other public health events, including chemical, biological, radiological, and nuclear threats in 9 languages. In 2005, Medicis, or the European Media Monitor Medical Intelligence System, which monitors reports on animal and infectious diseases, chemical, biological, radiological, and nuclear threats, and food and feed contamination, scanning reports in 45 languages. And in 2006, HealthMap brings together disparate data sources in real time, including online news media, eyewitness reports, expert curated discussions, and validated official reports on human, animal, and plant diseases in 15 languages. All of these tools have helped shape disease surveillance and reduce the time to detection over the past 2 decades. These tools are still making an impact today and are used by hundreds of thousands of health professionals around the world. Across the past several years, several smaller-scale innovative disease surveillance tools were created as well. These include Dr.Me, which is the first and the most downloaded mobile application for health in Thailand, with approximately 400,000 visitors per month. Dr.Me is a web and mobile-based application that provides users in Thailand with a free health-related advice, a tool to locate the nearest hospital, and a service to send for an ambulance in the case of emergency. The tool also allows users to self-report their symptoms and receive advice on how to treat those symptoms. Flu Near You is an online participatory surveillance tool administered by HealthMap of Boston Children's Hospital in partnership with the Skoll Global Threats Fund. On this site, any individual living in the United States, 13 years of age or older, can register to complete brief weekly surveys and report their flu symptoms, which helps to map influenza and provides collective understanding of the flu. Flu Near You provides data on influenza-like illness, or ILI, at local, state, and national levels, and creates a map of the ILI spread within the U.S. It also provides the user with a number of public health resources and connections to public health links. Since the launch of Flu Near You in 2011, over 140,000 users have registered. As of September 2015, 67,000 active users receive a weekly email to report symptoms for themselves and 30,000 household members. Over 1.3 million cumulative weekly surveys have been submitted since inception. The tool has demonstrated a high degree of correlation with CDC's Influenza-like Illness Network, or ILI-NET, and their surveillance system in terms of both timing and magnitude of ILI rates. Can you think of similar or different ways either of these tools can help your community? So how exactly has using innovative disease surveillance impacted time to detecting outbreaks? This chart depicts the impact of surveillance improvements over time. As you can see, the time to detect an outbreak has decreased substantially over the past 20 years. Some data indicate a more than 50% reduction from an average of 40 days to 19 days. This is primarily due to the adoption of the innovative surveillance methods we talked about earlier. Increasing the speed of outbreak detection in your community can make the difference between life and death. Pause the presentation here to answer the following question. Here are some examples of how innovative disease surveillance used to complement traditional surveillance has helped to identify disease outbreaks faster than relying on traditional surveillance alone. This first case study illustrates some of the challenges associated with traditional surveillance. As you go through this case study, think about how the use of innovative surveillance in conjunction with traditional surveillance may have increased the speed at which this outbreak was recognized and reported. This case study looks at a meningococcal meningitis outbreak in western Kenya. On January 23, 2006, a leading national newspaper reported that people in a remote area of the district were sick and were dying from an unknown illness. Symptoms being reported were fever and neck stiffness. Local health officials could not be reached for comment, and the information in the article was from an interview with a local religious leader. When district health officials were contacted, they said that they had seen some cases but had not yet reported them because they were still waiting for laboratory confirmation. When they did receive the preliminary lab results, they were negative. A national disease investigation team was called in, and they arrived on the scene on January 30th of 2006, a week later than the newspaper report. Their investigation established that the outbreak had been ongoing since December of 2005, and that the majority of the cases in the district were being treated in a neighboring district in Uganda, where a similar outbreak was occurring. By the end of the outbreak, there were 82 cases and 16 deaths. This case clearly illustrates some of the challenges of relying entirely on traditional disease surveillance and the gaps that can sometimes result. Paying attention to informal information sources in this case, as well as increasing the communication between the Ugandan and Kenyan health officials, would have significantly increased the recognition of this outbreak and would likely have saved some lives. This next case study illustrates how innovative surveillance methods used in conjunction with traditional surveillance help to rapidly identify an outbreak. This case looks at chikungunya cases in Mauritius and Réunion Islands. As you review the key facts of the case, think about how innovative surveillance techniques influence the outcomes. On May 18, 2005, a health professional reported on ProMed that in Mauritius since early April 2005, several people have been attending the hospital and health centers of the capital city, Port Louis, with fever and arthralgias of hands and feet. A rash was also noted. Chikungunya virus was suspected based on the clinical presentation, the self-limiting course, and the recent report on ProMed Mail of a chikungunya epidemic in the Comoros Islands. The diagnosis was confirmed on blood samples sent to Erasmus University in Rotterdam and Marseille Army Laboratory in France. The outbreak started in an area of the capital where there is a hostel often used by visitors from the Comoros Islands. According to newspaper articles, not long after this report, the first cases of chikungunya were reported on the island of Réunion, 230 kilometers from Mauritius, and the cases increased rapidly. How far did chikungunya travel? Let's take a look. This is a map of the Indian Ocean region showing migration of chikungunya from the various Indian Ocean islands to other regions, including Thailand, Vietnam, and Malaysia. Chikungunya spread through Asia, across the Caribbean, and into Mexico. This case shows us again why it's so important for health professionals to be aware of what's going on in terms of disease surveillance in other parts of the world, and why it's so important to create and participate in a global surveillance network. The EpiCore platform, which you'll have an opportunity to learn about later, will enable you to do this. If you'd like to see more case studies, please refer to the supplementary training materials section. As you saw in the case studies, innovative surveillance can be a valuable tool, but it's not without its challenges. Some challenges of innovative disease surveillance include false positives and false alarms, and the need to validate the information received. Please pause the presentation here to consider the following question. Let's summarize what we just discussed by comparing the traditional disease surveillance methods with innovative disease surveillance methods as shown in the table. Take a moment to pause the presentation here to examine this table. So what have we learned? We're all part of a global village. Disease travels as rapidly as humans can in a world that's continuously growing smaller. This is why creating a global network for disease surveillance is so important, and why it's also critical that we adopt innovative surveillance methods that, when used in addition to traditional disease surveillance, can help us increase the speed of disease detection. Non-traditional information sources may be the first indication of an unusual health event occurring in a remote area. Early sharing of information on emerging infectious diseases through non-traditional reporting channels may lead to more rapid official confirmation of ongoing outbreaks and more rapid recognition of cases in other geographic areas. Innovative disease surveillance approaches continue to demonstrate an ever-increasing potential to help us detect outbreaks faster and with greater sensitivity. For these reasons, we created a project called EpiCore, which uses innovative surveillance methods by leveraging non-traditional information sources and drawing on the knowledge and skills of trained health professionals around the world, like you, to help the world verify outbreaks faster using participatory epidemiology. So what exactly is EpiCore? A partnership between the Skoll Global Threats Fund, HealthMap, ProMedMail, and TefiNet, EpiCore creates a virtual community through its secure and exclusive digital platform that provides online training, allows resource sharing, and facilitates communication between EpiCore members in order to improve outbreak detection around the world. Platforms like EpiCore need the participation of human, environmental, and animal health professionals on the ground to validate informal surveillance data and to harness the full potential of innovative surveillance systems. By now, we hope you're excited about incorporating innovative disease surveillance into the traditional surveillance methods you're already using. An easy way to do this is to become a member of an innovative disease surveillance network such as EpiCore. We'd like to invite you to take the EpiCore platform training. Your membership will not only help you improve the health of your community and region, but will help all of us improve health globally.